Assalamu alaikum. So today is the 21st of December 2023 and here is the general surgeon. So today we will talk about how to take history from a patient who came with the breast lump. Okay. First of all, as already we discussed yesterday, first introduce yourself to the patient, then take consent that you want to take history to the patient, and if she is comfortable with you, so she will give you consent, or if the patient is male, so consent is also necessary in each and every case. Then biodata of the patient: age, address, marital status, occupation. So biodata of the patient. Then the presenting complaint. Usually a patient came with the complaint of lump in the breast, pain in breast, and discharge from the nipple. So basically patient present with these three complaints normally, or they may have other complaints also, like the lump which became ulcerated with time. So these are the complaint. And the last thing is lump in the axilla. So these are the presenting complaint with which patient usually came to the clinic. Then in on elaboration, first start with the complaints first. Like if the patient said she felt lump in the breast, so ask about the question related to the lump. So with lump, start with the lump. Specifically ask when did she notice the lump, and at that time what she was doing, like whether she was taking bath, and during clothes changing she noticed the lump. So ask this thing at that time what she was doing. And then you ask, and then you ask that before that whether she was all right, or not. Okay. Then ask about site, whether it's in the right breast, left breast, or upper quadrant of the breast, lower quadrant of the breast, inner quadrant of the breast, outer quadrant of the breast. So ask about the site of the lump, and then ask that like the lump was present there and remain there, or just changing its position from one quadrant to the another quadrant. So this is also a good question. So with this question, you may differentiate between the benign lump like fibroadenoma and with the carcinoma. Then ask about the size of the lump, either it's pea size, lemon size, or a size of a small apple. And if the patient has said the size of the lump is increasing with time, then ask about the progression. That in which time span the size of the lump has been changed. Then ask about the consistency, whether it was soft or hard or firm. Then ask about the condition of the overlying skin, whether it was or it is normal or it became ulcerated with time. Then ask about the pain in the lump. The questions of the pain we will discuss in another video. Then association of pain. One question is very important. Association of pain with masturbation. The benign lumps like fibroadenoma became painful with the masturbation. Did the patient took any treatment for this lump? Like any biopsy was done or any radiology, like ultrasound of the breast in the patient who is less than 35 years of age, and mammogram in the patient who is more than 35 years of age. Then ask about the history of trauma to the breast. And any other lump in the axilla, contralateral axilla, and another breast or in the abdomen. Ask about the discharge. The patient is complaining of the discharge, and ask about the discharge, like the color of the discharge, amount of the discharge. Whether the patient is able to quantify the amount. So ask about these two questions specifically. Then ask about the nipple condition, with whether the nipple is normal in shape or became distorted with time. Then ask about the other questions. Associated symptoms, basically. First symptom is pain, which we discussed already, and second is discharge. Like I mentioned, the color of the discharge, amount of the discharge, odor of discharge, and the nipple condition, whether the nipple is displaced, retracted, or distorted. So ask about the nipple condition. In weight loss, fever. So these are the associated symptoms you should ask in the history.